There's a battle that costs our country billions and affects every single one of us, but it mostly happens behind closed doors. Today, we're going to pull back that curtain on the huge conflict between your doctor and your insurance company. We're going to unpack the hidden friction that really shapes American healthcare.
Look at that number. That is not the budget for a small country. Nope, that's the estimated cost every single year of the war between healthcare providers and insurance payers right here in the U.S. That's $200 billion. So where in the world is all that money going?
Well, it's going into this massive, complicated, and, let's be honest, often super wasteful administrative process. This isn't money for medical research, or new equipment, or better care. It's the price of a system that's just drowning in paperwork and red tape. A cost that, you guessed it, eventually trickles down to providers, to payers, and to all of us as patients.
So how does a system that's supposed to be about healing end up wasting so much time and money? Well, a huge part of the answer is that they're aiming at a constantly moving target, the rules that decide what care actually gets covered.
This right here, it's just pure chaos. See, instead of one clear standard, every insurance company gets to write its own rulebook for what they think is medically necessary. There's no central library for these rules, and they can change all the time. We're talking up to 180 updates happening in a single day across the country. And to make it even more complicated, payers often hire other companies to manage all this, adding another layer of bureaucracy that your doctor's office has to deal with.
In this quote, this shows you the real human cost. This came from the case of a patient with a history of bone cancer. After a 10-day hospital stay that included a biopsy and scans that found lesions on their brain, their insurance company denied the stay. And the reason? It didn't meet their specific internal inpatient criteria, basically a checklist the insurer uses. The hospital met all the clinical guidelines, but the payer's own secret rulebook became a giant roadblock to care.
So, what happens after a denial like that one? The provider gets thrown into this exhausting loop. They have to appeal the decision, and on average, they do it 3 times. Even if they win, the payment for the care they already gave is late and often reduced. And if they lose, they're stuck. They either have to eat the cost and accept a much lower payment, or they have to try and bill the patient for it. It's a total no-win situation. So you have to ask, who really benefits from a system like this?
Okay, so if the shifting rules are one big headache, the next major roadblock is even more basic. It's the absolute nightmare of just trying to share medical information.
Before you can get a lot of treatments, payers are demanding more and more of your medical records. But how do doctors' offices send this info? Oh, it's a total mess. Some insurance companies want faxes. Yes, I said faxes in this decade. Others use phone calls or these clunky online portals. And those portals, they're often buggy, they lose files, they don't sync up correctly, forcing the staff to call and call again just to make sure a document was actually received.
And here's what that looks like in the real world. This whole process is called prior authorization, getting the insurer's okay before you can get a procedure. So a doctor wants to schedule an MRI. The office calls the insurance company. The insurer says, "Oh, we don't handle that. You have to go to this other company." So they go upload all the documents to that third party's website and system error. It fails. They have to do it all over again. And just imagine being the patient, waiting for that critical scan while all this is going on.
And the impact of this is just enormous. According to a huge survey by the American Medical Association, a staggering 92% of doctors say that these prior authorization processes cause delays in necessary care for their patients. This isn't just some administrative hassle, it's a direct obstacle that keeps people from getting timely treatment.
So, if the rules are confusing and the communication is broken, that brings us to the third battleground. And this is where things get really contentious. The fight for fair payment.
This chart tells a pretty troubling story. So traditional Medicare, the government plan, already covers only about 80% of what it actually costs a hospital to provide care. But then you have Medicare Advantage plans, which are run by private insurance companies, and it gets even worse. After you factor in all the denials and underpayments, those plans only end up reimbursing hospitals for about 74% of their costs. For doctors and hospitals, this is just not sustainable. When they're getting paid less than what the care costs, it leads to things like service cuts, staff shortages, or even hospitals having to close down.
And this creates a really bizarre situation. On one hand, you've got the big insurance companies going to the government arguing that they absolutely need higher rates to keep up with inflation. But then on the other hand, when they turn around and negotiate with the doctors and hospitals who are facing the exact same inflation pressures, they often demand rate cuts.
This timeline shows how these negotiations can just explode into these public showdowns.
There was a healthcare system down in Florida, NCH, that asked its biggest insurer, Florida Blue, for a pretty moderate rate increase. Florida Blue waited 3 months to even respond. The fight went public, which created huge uncertainty and anxiety for the entire community. Patients were caught in the middle, wondering if their insurance was about to become useless at their local hospital. And get this, the insurer only really came to the table to negotiate on the very day the contract was about to expire.
Shifting rules, broken communication, fights over money. These are the battles happening every day behind the scenes. But what does all of this mean for you when you're the one who actually needs care?
Right. After all this talk about policies and portals and payments, how does this war between providers and payers actually impact you when you need to see a doctor?
The impact is really direct, and it's pretty significant. It means delays in getting that MRI or having that hospital stay approved. And those delays, they can cause your condition to get worse, sometimes to the point where you need emergency care. It creates a ton of anxiety when your local hospital and your insurance company are fighting it out in the news. And finally, remember that $200 billion administrative cost? It doesn't just disappear. It gets baked right into the insurance premiums you pay every single month. We all pay for this inefficiency.
So here's the thing. Ultimately, both the providers and the payers will tell you that their main mission is to make sure patients get the care they need. But the system that they've built together is just full of roadblocks that actively prevent that from happening. In this complicated, expensive blame game, the biggest question isn't just who's responsible, but who is ever going to have the courage to finally clear the way.